Hi, I'm Dr. Ptacek. I'm an addiction specialist, and I'd like to talk to you a little bit about addiction. First of all, my simple definition for addiction is it's loss of control over the use of a chemical. That can be alcohol, that can be opiates, it can be cocaine, but addiction is the loss of control. Now, there are a set of criteria that can be used to formally diagnose addiction. It includes, you have to meet 3 of 7 criteria, and they include things like you either show tolerance to the drug, meaning that it takes more drug to get the same effect, or you show withdrawal if you stop the drug suddenly, or another one is that you spend a significant amount of time either getting the drug, getting the money to buy the drug, and then using the drug. So you can make a formal diagnosis using those 7 steps, and you need to meet 3 of them. But if you simplify down, if you have lost control over the use of that drug or alcohol, then you meet my criteria for addiction. Now, that's important to separate out. For instance, if you have a friend who has rheumatoid arthritis, which is a severe crippling arthritis, they're in chronic pain, they're put on OxyContin by their doctor, 60 milligrams 4 times a day, 240 milligrams a day, that's a very large dose. If you miss a dose, or at least 2 doses, for instance, your friend will go into withdrawal, so he has opiate withdrawal symptoms, but he is not addicted. Okay, he does not show loss of control. He gets his meds from one doctor, doesn't go to multiple doctors. He doesn't buy his meds on the street. He doesn't steal them from friends when he visits them and goes to their bathroom and rummages through their medicine cabinet. He doesn't borrow pills from friends and neighbors. So there is no loss of control. Now, he is physically dependent, and that's the important thing to understand, the difference between addiction and physical dependence. Physical dependence means if you stop it suddenly, you will have withdrawal symptoms, but there's no loss of control. So physical dependence by itself is not the same as addiction. All right. Now, you might ask yourself, well, I have friends who drank as much as I did or used as much narcotics as I did who didn't get addicted. So why does one person get addicted more than others? First of all, genetics plays a large role. Most of my people that I treat with chemical dependence have mother, father, relatives, brothers, sisters, etc. who are addicted, and so we know that it runs in the family. There's a whole talk you can give about how that happens, but I don't have time for that now. Secondly is the younger you're exposed to the drug, the more likely it is to become addictive. So if you have a 12-year-old experimenting with cocaine and a 30-year-old experimenting with cocaine, the 30-year-old is more likely to be able to not get addicted. Next is that once you've been addicted to any one drug, i.e. once your brain is changed, you're much more likely to get addicted to any other drug that you take. So for instance, an alcoholic who stops drinking, gets into recovery, but 3 years later hurts his back and gets put on narcotics, is at very high risk to wake up one morning truly addicted to the opiates. Lastly, another factor would be simply the amount of the drug that you use and how long you use it. For instance, many of my alcoholics say that they believe nicotine is more addictive than alcohol because they stopped drinking by going to AA, but they are still smoking, or they have more trouble stopping smoking sometimes. I don't believe nicotine's anywhere near as powerful as alcohol as an addiction, but if you use them both the same way. So if you only smoke cigarettes on Friday night and Saturday night and you only had 8 of them, or 10 of them, or 18 of them, I think not that many people would get addicted to them. However, cigarettes can be smoked 7 days a week. You can smoke up to 40 or more a day. And specifically, you can smoke them in the middle of your day. So 10 o'clock in the morning, you're at work, you're stressed out, you have a cigarette, it relaxes you. It acts as a drug, relaxes you, and you're therefore teaching your brain that the way to handle stress is to smoke that cigarette. You're not going to be able to start drinking until you get home at the end of the day, so it's just the alcohol doesn't perform quite the same function. Again, I think that's part of how opiates and other medicines can become addictive, because you can pop a pill while you're at work, similar to the fact you can smoke a cigarette. So bottom line is, the more of a drug you use, the more often you use it, and the time over years and that type of thing, those all play a role. Now, regardless, if you have become addicted, why is it so hard to stop? Why can you not just say, all right, ever since I started using cocaine, I've gotten in trouble with the law, I'm broke, my wife has left me, I'm going to lose my job, I have to stop, and then stop. Why is it not a simple decision? Well, it's because addiction is a disease. It's in the brain. An addicted person's brain is changed, and we simply don't know how to change it back. Now, if we look at the evolution of the human brain, first of all, there was the primitive brain, which is about the level of a frog, in my opinion. They call it the reptilian brain, like the dinosaurs. Secondly, the mid part of the brain, or the middle part, deals with emotions, and again, the person gets smarter. And I'd call that like at the level of a well-trained lassie dog. And then finally, the cerebral cortex is what makes you and I smarter than our dog in most cases. And that's the part that allows us to think and weigh pros and cons and make decisions. Now, I'm going to lump the first two, the primitive brain and the midbrain, together as one. I'm going to call them together the primitive brain. So now I want to look at the two parts of the brain, the primitive brain and then the thinking brain. Primitive brain doesn't weigh pros and cons or follow or make decisions specifically. It has a book of rules, and it simply follows the rules. Rule number one says it's our job to make sure he breathes, and so you're going to breathe. That's a wonderful thing. Imagine if you had to remember to breathe all day long, you wouldn't get too much else done, especially since you'd also have to remember to make your heart beat and all the other millions of things that happen in your body at one time. So your primitive brain takes care of those. Primitive brain says you've got to eat, you've got to sleep, you've got to drink fluids. Now, the thinking part of your brain, on the other hand, weighs decisions like what school do you want to go to, who do you want to marry, what shirt do you want to wear, those kind of things. It thinks, it makes decisions. Now, unfortunately, addiction is not in the cerebral cortex, it is instead in the primitive brain. So when you become addicted to opiates, for example, your brain has now added a new line. It says, and we have to have our opiates. Now, it's just like sleep. Even though your brain is going to make sure you sleep, it doesn't make you fall asleep every night at 9 o'clock and wake up every morning at 6. Likewise, if you're addicted to opiates, it doesn't mean you have to have them every day, every second, every hour. But the primitive brain is going to keep saying, okay, we've gone long enough without it, it's time to get some more. Now, what happens when the primitive brain, with its set of rules, collides with the thinking part of the brain? For example, the number one cause of death in a car accident in America is due to alcohol. The number two is due to falling asleep, although that may be overrun by texting in the near future. But right now, falling asleep is felt to be the second most common cause of death in America in a car accident. Now, so you have someone driving down the interstate at 80 miles an hour. His thinking brain clearly understands that he should not fall asleep, that he could be killed. But his primitive brain doesn't really care about that. Remember, it doesn't make decisions. It doesn't weigh pros and cons. It simply says, we're really tired, we didn't sleep last night, we're going to take a nap. Boom, falls asleep, has a wreck, gets killed, paralyzed, badly injured, all because the primitive brain doesn't weigh pros and cons, it just follows the rules. So, likewise, if the rule has now been added to your primitive brain that you have to use Lortab, then it doesn't really matter when your cerebral cortex says, but we can, if we go by it, we might get arrested, they're already watching me. Doesn't matter when your cerebral cortex says, or your thinking brain says, you know, the state's already investigating us, they can take our kids away, we just got to stop. Primitive brain just says, look, line 7 says we have to have our opiates, so let's go get some. That's what makes it a disease. It's because the brain is changed rather than just being a bad habit. You chew your nails, that's a bad habit. Your brain doesn't change before you chew your nails and after you got into the habit of chewing your nails. All right, now, that is in a crux. That's the crux of the reason why it is so hard to stop. And next we'll talk about some methods that might be used to help stop specifically opiate addiction, since that's what I'm really talking about.